Welcome, everybody. It's Dr. Vibe here. We're broadcasting live on March 21st, 2020. And the world is still here, folks. Don't worry, we are still here. And another one of our epic conversations, cross-Canada conversations for Black Canadians. And it's another epic event, and looking forward to getting some input, conversations from many people here. But before we get started, we always like to start our conversations with the UN Decade for African Descent reading. So first it'll be done in Anglais et Richard Sharp. So Richard Sharp, please read for us.
Hi, folks. I'm going to read the Decade for People of African Descent Statement of Truth, Black Settlers' Experiences. Our significant presence and contributions on this land predate the country of Canada by over 150 years. Indeed, up until 1961, over half of all Black people in Canada were Indigenous to Canada. Indigenous settlers to Canada includes your ancestors. Learn of that. Our sweat, skills, experiences, and contributions taken and used without consent and for free, built and shaped early Canada. Learn of that. For example, Viola Desmond, she undoubtedly pushed and carved Canada into the powerful promise that it is today. Learn of that. People of African descent are resilient, brave, spiritual, and master builders who have been central to the campaign for equality and an equitable Canada. The new goal is African Canadian truth telling. Starting today, learn of this.
Ashe.
Ashe, thank you, Richard. And could we get it en français? Hey, Floydine, I can tell by the voice that you're here. Who can give our reading en français?
Yep, I'll do that. I'll flip it in French on the screen so that Soraya can read it. Moment, please. One moment, please.
Yes.
Here.
Got it, Richard?
Yeah.
Okay. Go ahead, Soraya.
Okay. So, just give me one moment, please. Notre présence et nos contributions sur cette terre précèdent la Constitution du Canada il y a environ 150 ans. En effet, jusqu'en 1961, plus de la moitié des Noirs du Canada étaient des Autochtones. Vos ancêtres faisaient donc partie des premiers Autochtones du Canada. Souvenez-vous de cela. Notre sueur, nos compétences, nos expériences et nos contributions prises et utilisées sans consentement et gratuitement ont construit et façonné le début du Canada. Souvenez-vous de cela. Un bon exemple est Robert Nathaniel Dett. Il a indéniablement lutté pour que le Canada devienne la puissante promesse qu'elle est aujourd'hui. Souvenez-vous de cela. Les personnes d'ascendance africaine sont tenaces, courageuses et spirituelles et sont des constructeurs en chef qui ont été au centre de la campagne pour l'égalité et pour un Canada équitable. Le nouvel objectif est de raconter la vérité sur les Afro-Canadiens à compter d'aujourd'hui. Souvenez-vous de cela.
Merci. Thank you, Soraya. Thank you, Richard. Excellent stuff. So let's get the fun started, folks. So first up out of the box, we're going to have UNDPAD overview given by Richard Sharp.
Hello, folks. Thanks again, Dr. Vibe, for hosting the show. Great to have such a great showing of people coming out to participate. I want to give some quick shout outs before we begin to the Dream Legacy Foundation for their support of this platform. Without the Dream Legacy Foundation, we would not be able to be connecting as we are across the country through communities, through this Zoom online portal. And it's great that they're giving me the time to work on this as well, this great work as well. Meeting of the Minds, Floydine Charles Friedel, Sylvia Paris, Emmanuel Mels have been wonderful in creating the space that birthed the UN DPAD Push Coalition. Those conversations through the Meeting of the Minds have been instrumental in helping to shape some of the thinking nationally for Blacks in this country on how to deal with federal government spending and initiatives that are directed to Blacks during this UN decade for people of African descent. So I thank you guys. I thank you all in terms of acknowledgements. Dr. Vibe, as always, being there in terms of your great hosting. In terms of the UN Push Coalition, I've been asked to speak for a few minutes, and I'm going to try not to go over my time. As people know, I like to talk. But suffice it to say, people that have been supporting this work and instrumental to the work of the UN Push, definitely the people that I mentioned in terms of Meeting the Minds, but also Andrea Pierce, who is also here in Ottawa with me, who has been really driving a lot of this work while I've been off trying to save the world in other capacities. So it's been great to have Andrea doing some of this driving work. Just very quickly, the UN Push started last year out of a meeting of the minds gathering to talk about how to capitalize on funding that was going to be made available to Black communities within the context of the UN decade. There was actually conversations that have been happening since the UN decade started in the GTA. A number of groups came out of in 2017, came out of the National Black Canadian Summit that was spearheaded by the Michael Jean Foundation. And some of those groups were participated in discussions with senior levels of government around what it might look like to have a UN decade declared and supported in Canada. In January 30th of 2018, the federal government announced endorsement of the UN decade, and that started a series of conversations, or continued a series of conversations with federal ministers, bureaucrats, community representatives on how to make the UN decade real for us in tangible and demonstrable terms. We had been working sort of behind the scenes for a number of months until around March of 2019, when we were successful in influencing some monies around capacity assist for Black communities and Meeting of the Minds, and supported Meeting of the Minds in pushing out through CAFCAN, the Canadian Institute for People of African Descent. That work continued on through the Department of Employment and Social Development Canada, through the Push Coalition, who galvanized the support of dozens and dozens of Black organizations from across the country. We were successful in helping to design a means in which we could access $25 million of capacity assist for Black communities, to assist Black communities in doing, Black community organizations in doing the work that they do well, do it better. And we were successful in getting agreement by a representative group of Black organizations in the summer of July 23rd. Prior to the election, we were also successful in getting all of this money secured for Black communities by the previous minister responsible for this file, the Black file. And unfortunately, things have stalled a bit in terms of moving this forward. We were hoping to have see results of the work in terms of a call for proposals and monies made available to Black communities by this year, February, or at least by the end of March. That is not materializing as of yet, and we are going to continue to work with the bureaucracy to and our new champion, Minister Ahmed Hussein, to try to make that real in real time. The intent of those initiatives was to make sure that Black organizations served as the as intermediaries to help drive monies from the federal government to Black communities and Black community organizations. Unfortunately, like I said, that has not transpired. But we have through a lot of the work actually of Andrea Pierce, been driving a number of conversations through at the political level. We've been advocating, letter writing, and engaging communities on sharing our sort of dissatisfaction on the pace of this change, and also recommendations on how we can actually move forward to get those results. Some of us are embedded in bureaucracy, and we have experience working with government, and we know what it takes to be able to move things. And we're actually, a part of this call is also to rally folks around the work of the coalition and Meeting of the Minds and other initiatives led locally and nationally to support Black organizations out in Nova Scotia. They're in Nova Scotia BPAD, folks in Montreal, Sunset, and folks in Winnipeg, Black Space, lots of folks doing work in Winnipeg, folks on the BC coast doing work with housing and homeless, and of course Alberta and so on. So we're hoping that we get more people to sign on to help drive some of this work. Our website will continue to post information of some of the things that we have been doing. We were successful recently. We were successful in putting a chapter in the alternative federal budget for the UN decade, which speaks to a lot of the initiatives that we've been driving in terms of economic inclusion, capacity, and other supports for Black communities that the federal government could provide. Most recently, we were also on a call this afternoon with Minister Hussein, where there were some sort of commitments made, at least light commitments around ensuring that there's a Black lens applied to the rollout of the COVID-19 funding and supports to marginalized communities and communities at large. Black communities make up some of the largest of the marginalized communities. We catch the most hell in policing. We don't always get our fair and adequate share of healthcare, and the list goes on and on. COVID-19 creates a bit more of a crisis for our communities, and we recognize that. Under the leadership of Emmanuel Melv, we have been meeting to engage each other on COVID-19, and part of the reason that we're here today is to push for continued engagement and collaboration across Black organizations. If we don't do this ourselves, I don't think there are very many other people that will. So this is a great opportunity for us to connect and advance some work and initiatives, share information, and concretize, strengthen our networks across the country. This is, I think, one of the best platforms to be able to do that in real time. So I think I'll end there. I don't know if we're taking questions, but happy to take questions later on or after Emmanuel has done his presentation.
Oh, thank you, Richard. I'm just wondering in my mind, should we get a translation in French? But I don't, that's a lot to translate in French. So we're just gonna move on to our next friend who's gonna share with us. And again, just a few things. We're gonna have a general Q&A in a little while, folks. So if you have questions, if you're online, notify me via the chat room that you have a question or discussion point. If you're on your phone, if you want to speak or have a question, you can text the following phone number, 416-717-3535. As I mentioned, we have a new friend to our platform this evening, and I'll give you a little background on her. Her name is Roxanne Bob Semple. She's got a long bio, but I'm going to condense due to time. She was born and raised in Toronto. She's an advanced practice nurse educator at the University Health Network in Toronto. She has extensive nursing experience ranging from the intensive care unit at North York General Hospital, which is just down the road from me, a senior manager, clinical specialist with the Royal Bank of Canada Insurance Company, a professor of the Health Sciences Program, Seneca College, as well a nurse examiner with the Center of the Evaluation of Health Professional Educated Board. She's also pursuing her Master of Business Administration with a specialty in Human Resource Management, Lean Six Sigma certification. Man, I've not heard of Six Sigma in a while, from the University of Toronto, and has a passion for and has been involved in quality and process improvement initiatives, which led her to obtain her Lean Six Sigma certification, University of Toronto. And last but not least, she's the author of Lead Influence, Secrets to Others, Leading Others Inside Out so they can achieve a higher state of performance. She's going to share with us about this little thing that's going on while we're out, basically while we're out in our yard tonight. She's going to chat about the coronavirus, the COVID-19. So Roxanne, a pleasure to have you on and looking forward to having you share. And the floor is yours.
Thank you so much, Dr. Vibes.
Pleasure's mine.
And thank you, Andrea, for actually, inviting me on this platform for the discussion. So, I mean, as we all know, there's a lot of uncertainty right now, right, in the world, which has been occurring for some time now. However, it's actually escalated quite a bit with the development of the coronavirus, and AKA or is the COVID-19. So I've been asked to just share at a very high level some facts about the coronavirus. And just before I start, I just want to say I'm not a medical doctor, right? So the information that I am sharing today is available for, the general public knowledge. But the coronavirus is really, it's a large family of viruses which may cause illnesses in animals and humans. And in humans, several coronaviruses are known to cause respiratory infections ranging from the common cold to more severe diseases such as severe acute respiratory syndrome, such as SARS, which we saw in 2003, and the Middle East respiratory syndrome, MERS, which we saw in 2012. And now, the most recently coronavirus disease is the COVID-19. So in December of 2019, in Wuhan city, the capital of Hubei province in China, this Hubei became the center of an outbreak of pneumonia of unknown cause. And what they did, like the Chinese scientists there, they were trying to figure out, okay, what was the cause of the disease? And, by January 7th, 2020, they were able to isolate the novel coronavirus, and it was later designated as the coronavirus disease 2019, or COVID-19 by the World Health Organization. Now, the thing with COVID-19 is that it presents in many different ways. So someone can present, they can be asymptomatic, right, with the infection. They may have mild upper respiratory tract illness, and they may have severe viral pneumonia with respiratory failure and even death, right? With many patients being hospitalized with pneumonia, as we're seeing quite a bit of deaths in Italy, right? Because the population there is much older, right? Now, the symptoms of COVID-19 usually takes up to 14 days to appear after exposure. And it really is diagnosed based on symptoms and also via a nasopharyngeal swab, so a swab of the nose. And then while in Western and traditional or home remedies, there really is no evidence, like with all the home remedies and the traditional remedies and the Western remedy, there is no evidence that there is medication to prevent or cure the disease. And the World Health Organization actually does not recommend any self-medication with any medicines, including antibiotics, as a prevention or cure for COVID-19. However, there are still, several ongoing clinical trials that include both Western and traditional medicines. And the World Health Organization, they have advised that they will continue to provide updated information as soon as they have clinical findings that are available. And there's also no vaccine, and there's no specific antiviral medicine to prevent or treat COVID-19 either. So, however, those affected should receive care if they do have symptoms, and people who have serious illnesses should be hospitalized. And most patients generally tend to recover, especially with the supportive care that we have, the level of supportive care that we have here in North America. Most who are affected should be able to recover. Now, the information that we currently have as to how COVID-19 is spread is that it is spread via droplet particles, which usually is generated by coughing or sneezing. And this is why they actually have recommended the social distancing, right, of 2 meters when out in public. And also now they're recommending it in your homes as well. However, we have also been advised that there's the potential of COVID-19 to be spread via airborne particles when particularly performing aerosol-generating medical procedures, such as if you're in the hospital, like for intubation, chest compressions, inhalation treatment. So if somebody is asthmatic and they're receiving like the Ventolin Atrovent, that would be considered to be inhalation therapy. So those of us working in the healthcare system, because I understand there's a few individuals on the call who are in the healthcare field, but those who are working in the healthcare system needs to be mindful of this and use an N95 respirator mask when performing these procedures. So it's different than the regular surgical mask that they're recommending that we use. Now, the facts about COVID-19 is that the virus has no ethnic, racial, cultural barrier. Now, I've been seeing quite a bit on social media, individuals posting that the virus does not affect individuals of African descent or Black people, which there is no available evidence to support this. And my fear is that we as a community will not take the proper precautionary measures to protect ourselves and our loved ones from getting COVID-19. So everyone just needs to do their due diligence to protect themselves and those that they come into contact with. The other fact is that older adults and immunocompromised individuals are at a greater risk of severe illness from COVID-19. So the younger individuals with COVID-19 may present with milder symptoms. And this is why you may be hearing as well, you have the university students or the high school students who are going around saying that, they're not going to get the virus, they're not worried about it, they're still going to be involved in social gatherings. But what they forget is that, yes, they may have the symptoms mild, or they may be totally asymptomatic, but just say if their parent is older or their grandparents, say, for example, who is over the age of 65 or who may be immunocompromised or has some kind of underlying medical condition, they're putting their loved ones at risk for developing the COVID-19, and not at a mild rate, if you want to say, but it can be severe. That would require them to be hospitalized. And one thing to keep in mind is that, within the Black African community, conditions that are commonly seen, but not limited to, are diabetes, heart disease, kidney disease, cancer, sickle cell anemia, hypertension. So these are all conditions that make that person immunocompromised, and of course their medical condition. So they're immunocompromised and at risk for developing severe symptoms if they do become diagnosed with COVID-19. So, if you have a loved one who has, or if you yourself have concerns about your condition and the risk that the COVID-19 presents to you, just my recommendation would be just to have a conversation with your healthcare practitioner, just to discuss it further, because there's a lot of anxiety out there, and there's a lot of myths and misconception about the actual virus. So it's always a good idea just to have a conversation with your healthcare practitioner. And the third fact is really to know the signs and symptoms, know what they are. Like many flu-like viruses, COVID-19 virus actually causes an illness that's characterized by fever, cough, and shortness of breath. And you may also experience chills, body aches, sore throat, headache, diarrhea, nausea and vomiting, and a runny nose. So these symptoms are usually mild and will begin gradually, but some people become infected but don't develop any symptoms and don't feel unwell. This is the scary part about it, right? And most people, about 80%, recover from the disease without needing special treatment. And around 1 out of every 6 persons who gets COVID-19 becomes seriously ill and develops breathing difficulty. And people with fever, cough, and difficulty breathing should seek medical attention. And given that we are in peak season right now, flu season, peak flu season, many people will present with these symptoms. And most will not have COVID-19, but it needs to be ruled out. If you are in contact with anyone with these symptoms, the recommendation is to self-isolate and contact telehealth or go to your nearest assessment center for further directions. So there's different assessment centers that have been set up across, I believe, the country. I know Ontario there is, but I believe also across the country there's been assessment centers set up, but if not, there's always like telehealth. And what they will do is they will do further assessment, which includes assessing for recent travel history, or have you actually been in contact with someone who recently traveled, which more likely they will ask you to isolate for 14 days. They will assess in regards to if you have been in contact with someone with COVID-19, or if your community has a spread of COVID-19. Right? Because we may not be aware of the numbers of positive COVIDs in our community. And as healthcare workers, if you work within the acute care setting or long-term setting, you need to be aware of your own signs and symptoms. And if you exhibit them, do not go to work. You need to get assessed by the nearby assessment center or call telehealth. And last but not least, the best approach is prevention. And there are simple things that you can do to keep yourself and others healthy, such as hand washing with soap and water for at least 20 minutes. Avoid touching your eyes, nose, and mouth with unwashed hands. Those are your mucous membranes. Do some self-monitoring. And if you've traveled in the last 14 days, self-isolate. And practice social distancing, which is 2 meters apart in public and at home. Avoid contact with people who are sick and staying at home when you are sick. And using your elbow to cover your mouth, nose when coughing or sneezing, and throw any facial tissues in the trash and disinfect surface areas. And don't forget to check on your loved ones, one thing, I really don't, me personally, I don't like the terminology social distancing, but I get why they're using it, just to get their point across. But don't forget to call and check in on your loved ones just to see how they're doing, especially if you know of someone who's elderly or immunocompromised. We really don't want them to, really go out in the communities due to them being more susceptible. Also, they may be at risk for developing depression, right? Because if it's, say, an elderly grandmother, elderly parent, they no longer have that independency really to really go out and move around as they wish. And if you have children, sometimes their grandchildren are the only reason for them being. So, FaceTime them with your kids and just, try to be as present as possible to them. And then those who are not, like your friends, you just check up on them, give them virtual hugs, just make sure that they're okay. And we just need to be good to everyone during this challenging time, right? Now, information can be found on the CDC website, the Ministry of Health, Public Health website, telehealth. Those are very good resources that you can go to if you wanted further detail in regard to the COVID-19. But just everyone be safe out there, right? Because we don't know what this virus is capable of doing more, right? We know what it does right now, but we don't know the extent of it. So, yeah.
Okay, well, Roxanne, thank you so much for a great breakdown. Getting it from a Black perspective is always a wonderful thing. If anyone has any questions for Roxanne, hold them off after our next set of presenters. There'll be an open forum for questions, so get your questions ready. So I'm just going to prepare our next two people who are going to share with us. So I'm just going to make them available right now. So I will give a short little background on both of them. First up, the man who did a great job hosting this afternoon, Emmanuel Melz, is the director of the Network for the Advancement of Black Communities, NABC acronym, at York University and principal of Aman Consulting. I could go a long way, but I'm just going to leave it at that. And his new role is superhost. He loves that one. But the other lady, the lady here we have is with him is Nadine Spencer. She's the Chief Executive Officer of Brand EQ Group, a global marketing and communications agency made up of top-level creative professionals from around the world, specializing in clients' meetings, marketing, communication, and PR goals. I could go further with that, but she's also the lady in charge, or the person in charge of the Black Business and Professional Association. So they're going to share with us in regards to this current situation, in regards to the perspective of safety and economic security. So welcome to the platform, Nadine and Emmanuel. The platform is yours.
Great. Nice to be here. Emmanuel, I'll let you start in.
Okay, thanks Nadine, and thanks Dr. Vibe again for hosting this great coming together of the village, so to speak, on a very important day. I think when I reflect on this day, which is March 21st, about 60 years ago in Sharpeville, South Africa, a peaceful protest ended up in bloodshed. About 69 Africans were killed, and that's kind of the trigger for us to really globally come once in a year and think about how it's important to fight racial discrimination and hate. So it's a somber moment, and I think it's an opportunity in the context of this crisis for us to come together and as a community reflect a little bit. What I will be focusing mostly is kind of how this crisis is playing out itself in terms of the nonprofit sector. And I think Nadine will touch base on the business side.
That's right.
So I think like all of us early this week on Monday, we had our first call to start making sense of what's happening, yeah? And I'll be talking about that in a moment. And I think that was kind of a reaction among all of us to say, what matters now? What should we do in terms of rallying the troops around this challenge that we have? And I think I noticed very quickly that, a number of sectoral organizations moved fairly quickly to put statements out, lobby and advocate on behalf of their constituents. And I have shared early in the week with some of you organizations such as Imagine Canada or the Ontario Nonprofit Network and others that were able to really assess quickly what needs to be done in terms of policy advocacy. And I have underscored the value of a national Black voice that speaks and mobilizes our capacity quickly in situations such as this. Until such time, when we have the Canadian Institute for People of African Descent, it's very important for us to think about how do we organize ourselves in terms of ensuring that there is that collective voice. And I think this brings me to this concept of the Black ecosystem, yeah? The Black ecosystem for me, it's an ecosystem where, we have faith leaders, business leaders, nonprofit sector leaders, informal group leaders. We have so many small informal groups in our communities that make things happen. We have professional associations and groups, like, we have professional associations that bring together, Black medical professionals or Black lawyers or a host of various professions as such. So when you look at the Black community writ large and you start thinking about an ecosystem, think about the flow of energy, the flow of ideas, the flow of assets within this ecosystem, and how we can actually tap into that to be able to bring the best in our community to advocate and be at those important tables. I feel like entering into a new normal. It's adversity as it is an opportunity for us to actually bring renewal. And I feel like the work that we're doing and we have intensified in doing this week is to enable us collectively as Black community organizations, leaders, and part of the ecosystem to be at the critical tables, like policy tables, funding tables, government tables, so that we're not left out. If we have Black leaders, Black organizations, all these critical players in the Black ecosystem not working in unison or being at the periphery, what happens is like our communities, families, children, mothers, sisters, seniors are much more isolated and marginalized. So we are the voice in a way, and we have to really work together. So what I would like to do at this stage is to share with you what has come up. And part of it, I think, was reflected in what Richard was sharing earlier on, yeah? In terms of, if we start to put in a Black lens to this crisis, what are some things that we'll actually be able to see? So, he spoke about collaboration, for example, yeah? About the collective voices. What I would add there is if each of us bring our individual gifts to it, in what ways can we actually start looking at preparing the capacity of our community to move forward? So on this week, early this week, when we facilitated a call to try to take feedback, there were about 6 areas that were identified as important for us to collectively work together and exercise leadership. And I'm not going to go into the details. Be happy to entertain questions later on or seek your feedback. But areas around, for example, what are some things that we need to have in place for resources for children? Yeah? How do we support children, especially in an intergenerational way? Yeah? In terms of how we recalibrate our policy advocacy area, yeah? And what's the type of activism that we need to start thinking about, yeah? So there are different sectors, homelessness, youth, children, health, international students, and so on, that require attention in terms of policy advocacy, yeah? And how do we organize ourselves along those dimensions, yeah? An entire area around businesses that Nadine is going to touch base, but importantly, how do we actually ensure the survival in this moment and post-COVID of our critical businesses, yeah? There is a host of issues around nonprofits. Some of the calls I fielded this week was from executive directors asking me for advice on what they should do. And this is before even the package was announced. Because a lot of the Black organizations in the nonprofit sector, they depend a lot on project funding, short-term project funding. Those who receive core dollars you can count them in your hand, yeah? And so, which means like, when there is a crisis such as this one, they need to seek advice in terms of whether to, lay off their staff on a short-term basis or whatever is saying to do. So around, loss of revenue, around, fundraising, accountability for funders in terms of lightening the administrative oversight, the timelines for reporting, requesting grace around some of the stuff, not forgetting of some of the vulnerable members of our communities during this difficult time. One great thing that is been suggested is like, there's a lot of stuff happening in Black community organizations, Black communities across the country. We need to find a way to catalog this and make sure that the left knows what the right is doing, so that, we complement our work. I think there was great discussion about the value to reach out to faith communities, yeah? We don't think about faith communities, but faith communities play and faith leaders play an important role in this ecosystem, yeah? Especially at this time when people are no longer congregating because of social distancing, as Roxanne was talking about, or physical distance. How can we actually support them through technology and so on to facilitate the engagement, yeah? Vulnerable community members, that's what the 6th and last area that was identified, folks in disability, seniors, people that are having challenges, mental health and psychological trauma, the homeless and those that are in the shelter system. So when you think about these 6 areas, I think the key question is, so where do we go from here? What do we do about some of the needs that we have? And I think in the call today with Minister Hussein and Adam, what clearly as a takeaway for me is this thing that again and again, especially how Adam Vaughan emphasized, that we need to be able to get our community members quickly to file their taxes. Whatever help that we need to do to get them there, that is the best contribution that we can play pronto now, means, yeah, in terms of support. But for me, the big question is like those leaders that are in this call and across the country, how do they actually raise the bar for themselves in terms of boldly being at those important tables? When we talk to funders, I've been talking to a few of them on behalf of the agencies that I am connected in my work at NAPSI. What are some of the flexibility they must show during this time? What are some of the crisis funds that they need to put in place? So we need to be able to actually think about connecting the dots here and look at what Imagine Canada is pushing. Look what ONN is doing. Look what Philanthropic Foundations of Canada is doing. All these important sector players that are heard by governments, we must be at that table. And that's for me, the so what of all this, yeah? The collection of data, the bringing the troops together at the end of the day. I spoke with some of you earlier on as we were preparing with this call with the minister. We must have a relationship for accountability for results. It's not simply us advocating and really getting tired to raise our voice. We must, at the end of the day, bring the resources that are needed to the nonprofit sector and other components of the ecosystem. The last comment I would make here is, you know, our communities, pretty much like the Italians, are very social and connected. And so social distancing at this time, and that's one of the things that's hitting Italy because they are so socially connected and the way they live. Our communities, they congregate in churches, in community groups, in events, and we are literally a village in terms of how we relate to one another. Social distancing is difficult. I think people start talking about physical distance. And what I would add there is that we need to really push for social connections and social cohesion. And to do that at this particular time, as Roxanne was mentioning, whether it's FaceTime or picking the phone, technological tools that we can deploy, we must not further isolate and marginalize our community. So it's very, very important for us to remain connected through these new ways. And I'm hoping that in this new normal, the Black community and its leaders and organizations would learn a lot and be different actors in this country that we call Canada. So I'll stop here and then yield it to my sister Nadine. Thank you.
Great, thank you. Dr. Vibe, great to join you on this call with everybody else. You know, I am head of the Black Business and Professional Association, a 38-year-old organization in Canada that exists to advance and create economic opportunities for Black businesses. Over the past, week, we have had various conversations and phone calls from businesses that are suffering already. It has started even before it's really started. And when you look at the various challenges that Black business suffer from, we can clearly see that this is going to be huge impact on Black businesses, which trickle down to our families. The Black employment rates remain disproportionately low based on well-documented employment discrimination realities. As well, Black businesses historically has consistently faced systemic barriers to accessing capital. The key questions as it relates to COVID-19's impact on Black people in Canada must be asked, namely in the fact that, how many Black employees have access to paid leaves of absence, childcare challenges that impact Black people in underserved and marginalized communities. How has uncertainty in socioeconomic circumstances during this pandemic impacted the mental health and well-being of Black parents and families? I had a phone call from a business owner who just felt that he was, basically at the end. And so I think, part of the business model is that we have to also look at the mental health of our community as well. And, how will small businesses within the Black community survive or navigate this pandemic? So these are really important questions. And, there are unanswered questions that community stalwarts and business leaders are wrestling with. And when you unpack the stats associated with demographics with our community, it's alarming. The 2016 census showed that 20.8% of people of color in Canada are low income, compared to 12.2% of non-racialized people. Racialized women earn 58 cents, and racialized men earn 76 cents on the dollar. And for every, and the labor force participation rates was 66%, 0.1 amongst Black women, over 5% points higher than that of non-racialized women. Yet unemployment among Black women are roughly twice the rate of non-racialized women, 12.2% versus 6.4%. And their earnings gap was significantly larger. Black women earning 59% on average of every dollar that non-racialized men earn. So, the discrimination in the labor force, which, trickles over to businesses, is quite significant. And one of the areas we're working with is Eglinton Avenue. We're working with an area called Eglinton West. It's Little Jamaica. And a lot of the businesses there has been really annihilated over the fact that there's been a regentrification with the Metrolinx expansion, but the businesses, they weren't consulted. And so they're sort of, a lot of the stores have closed already, and they need support, and we're working with them to provide that support. But this COVID-19 has made it significantly worse. And what we're working on, what we're doing is doing a needs assessment for the businesses that are stakeholders and members, and not just within the Toronto. We have people reaching out to us from all across Canada. And so we're doing a needs assessment to see where the businesses are hurting, what are their pain points that they're experiencing immediately. And one of the things we found is access to capital and all of that, but technology is how to, within this COVID-19 pandemic, where businesses have to now revert to being online with social distancing and a lot of the stores are closed. How will they survive, especially in the wake of not having technology on their, not being technology ready? And when we look at certain solutions, like people say, well, we can have Uber Eats and we can, they can deliver the food out to people. The challenge for Black businesses is Uber Eats, I think, takes, one store said they take 35%, but even if the range is 25 to 35%, you can imagine that when you have a menu of, $10, and when you're giving away that large portion to a food delivery service, it doesn't work for Black businesses. So McDonald's can afford to do that because they use it as a marketing incentive, but Black businesses certainly cannot do that. And so, I was on the call, the two calls that we had, and there are Black businesses are mentioned in the various stimulus packages, and the solution that's offered to relief measures for businesses is, the income tax. All businesses, we're now able to defer the payment of income tax amounts until after August 31st, 2020. There is an increase of credit available to small and medium and large businesses. And I was just looking at it on the website, and apparently businesses can go to the 6 major banks and talk to them, and they've reduced the risk factor for how people qualify to get these bank loans. Well, we all know traditionally, banks are very discriminatory to Black businesses. I'm a Black business owner myself, and I can speak to that. And a lot of the complaints that we get from businesses is that, there are discriminatory practices at the bank level. I was very pleased to hear Adam Vaughan say today that they are aware, the federal government is definitely aware of that, and that they are taking stand that should not happen, and that if any bank should deny a Black business financial access, that we should bring it to the government. But the important thing for the Black business community now is the immediacy, the fierce urgency of now. We cannot wait. We will be out of business very, very quickly if we don't get immediate relief. And so while the federal government has offered, and I'll continue with the various relief offered, there's support for export development. There's also the deferred mortgage payments. But again, that some of the conversations I've had with different business owners is that, you have to have a good credit score, and they feel that they may not be eligible for that. And I think what's missing is that there has to be a how. I went on the various websites and there isn't necessarily a how we're going to get this done for the business owners, which I think will be a further barrier, discriminatory barrier, or just having access. I think the another challenge is that the information, the information to the various businesses across the country is, we understand it and we get it very clearly, and it's open. We're the converted that's drinking the Kool-Aid, but for everybody else that this is going to affect, there isn't really a clear path to the support. And of course, in our role at the BBPA, our job is to make sure that we have that transparency and where the businesses can come and get the support they need. But I think, on the phone call this morning, with Minister Hussein talked about, having a Black lens approach, and there definitely has to be a Black lens approach in terms of the support that the Black businesses will get across the country. When we look at the ratio of, one of the things that we're looking at is the ratio of dollars as a percentage per population, to see if, for example, there's 30 billion, if the Black population will get for 4% of that. So as we continue to really look at what's possible and how to navigate the path through this process, it's important to, as we all discuss, like, these conversations are important. It's important to connect and to share the information as much as we possibly can, and to recognize also that there's a way to communicate to get the information out to the Black businesses, and leveraging and using Black businesses to get the information out as well. So I think these all have to be intentional acts. And we'll continue, our lines are open, our doors are open to continue to support the businesses as they need. And we continue to call and to get the information from them so we can find out how and where to support.
Okay, thank you so much, Nadine and Emmanuel. That is fantastic stuff. For those people who are logged in online, throughout this conversation, we're going to be doing polls. And the first poll we're just doing right now: have you been laid off or your hours reduced due to the coronavirus epidemic or situation? And I'm only going to keep it up for another minute or two, but right now, 68% of the respondents are saying no, 32 are saying yes. I will have that pull up for another minute or two, but we have some more polls going on throughout the conversation. Now we are at our Q&A time. Now, if you would like to ask a question, if you're online right now, please notify me right now. If you are on via phone, can you text this phone number, 416-717-3535? And if possible, if you have your question directed to any one of the people that have shared this evening, that would be helpful. So I know that someone is wanting to come on here. Andrea, you had something you wanted to comment, so go ahead, please.
Hi, everyone. Welcome to the call. Thank you, Nadine. Thank you, Richard. Thank you, Emmanuel. I think what I'd like to kind of just frame the conversation a little bit to say, one of the goals of this conversation is to make sure that we have a cross-section of people's needs after the meetings that I've been having this week, to make sure that everyone's voice is heard and their needs, whatever gaps that they see with the stimulus package, both on an individual level. From nonprofits, for example, there is nothing really in the stimulus package for nonprofits. Faith groups are completely left out. For example, these stakeholders that are on this call, we want to hear from you. And what does this stimulus package really mean? If you have any questions around that, you can ask those as well. So what we're looking for is what we've heard before and what are your needs, because from everyone here that will be advocating on the community's behalf to the various government departments, including a conversation we had today with Minister Adam Vaughan from the Toronto one of the Toronto ridings, Minister Hussein, who's over ESDC, which has a huge portfolio that touches every Canadian lives, including most of the benefits that's in the packages, like the child benefit and all that goes through his department. And so that's really one of the practical things that we want to get out of this meeting. So please feel free to tell us, what are your needs? Where do you think that the stimulus package that you've heard about, you've seen, is missing things for our community? Are these areas that you see places where we can take advantage of, or do we need something different from the system? So please feel free to share particular faith groups. We want to hear from you. So please chime in and tell us what your needs are and what do you think you need from the government at this point. Are these things helpful to you, or you won't be able to access it? Or do you need more things that's not been identified? Thanks.
Okay, so if anyone has something to say, whether phone or text, we're open for your comments. If you're, again, online, just say you want to say something in the chat.
Yeah, Dr. Vibes, Robin.
Yes, Robin, go ahead, please.
Hey, everybody. Thanks to all the presenters. I got a question actually for Nadine, a couple of questions. One is, are there, and I have a comment. So the question is, are there stats on the racial discrimination by banks? Like, have there been any reports on that? And then in terms of the businesses, the area in Toronto you're mentioning where businesses had closed, the Jamaican businesses had closed, I'd be curious to know if you know what percentage, if any of those businesses owned the properties that they were actually on. So those are the questions. But the comment I had is, Andrea, in relation to what you're saying, the one thing that I didn't see in the government's measures was related to a recommendation made by the group ACORN, the national group that works with low-income people, that the government immediately instruct the Canadian Mortgage Housing Corporation to inject a bunch of money into existing rent banks, which are things that give people short-term rent supplements so they can pay the rent so they don't lose their houses. And it seems like something that can happen quite quickly, and I didn't see that in the package. So we had a call a couple of days ago with again Minister Hussein and Greg Fergus, although there's some technical issues, so they wanted us to email questions in after, and that was one of the ones that I emailed in. But Nadine, do you know the answers to those questions?
So the conversation that I've been having with people like Dr. Carl James is the lack of numbers on Black businesses in Canada. It's very disappointing and it's very sad. The numbers that we have is just so not relevant. One of the numbers we pulled up, which I didn't share because it just didn't seem correct, it stated that there was 2,000 businesses, Black-owned businesses in 2015. We know that's not true, right? So there is adequate data to support what the real numbers are for Black businesses across Canada, but we are looking into that because if you can't measure it, it doesn't count. And so we are really the next step for us, is to get the funding to get that data. And in regards to Eglinton West, again, no strong numbers, but the stores that were, if you drive by, it was a vibrant community at one point. The area is called Little Jamaica. They're trying to get it now to be recognized as a heritage site, but even that is a fight. They're calling it now International Alley because they want to sort of take away the Little Jamaica status from it. I would say, I have a list of 80 businesses that we're working with, but there were probably at one point, maybe 200 businesses, and even the current list I have of 80 businesses, there are really 30 solid ones that I know that is open and has a thriving business. So again, we need more data so we know exactly what's there.
And sorry, you were saying that there's no data on the number of Black businesses, but is there any data on the racial discrimination because this is related, obviously, of the racial discrimination by the banks in terms of loaning money to Black businesses?
No, again, no, not
No? Okay.
not at the moment.
All right, thanks.
Before we
I have a quick
go ahead,
response to the
go ahead,
question.
Richard.
Robin, I've been having some sidebar conversations with the Canadian Human Rights Commission, and they're actually looking into that. Nadine's right. There's no data on that kind of stuff. Nobody's gonna. People don't keep data on when they're discriminating against our people. So I think that the Human Rights Commission and some of those conversations are about maybe doing an inquiry or some kind of national review on the banks and other social services that discriminate against Blacks as a practice.
I just want to jump in here. The concern I have with this is during the time the data is being collected, that could be a time where things get taken away. Right? It may be used as an excuse saying, well, we're collecting data and things could be just taken away from us. So that's my big concern. We all know the challenges. It's right in front of our face. We have to collect data to make it happen. I know it's important, but the thing is, while we're collecting data, the situation's getting more challenging. Just putting it out there. Go ahead, Emmanuel.
So I'm really interested in hearing from many people, but this issue of data, and I work very closely with Carl James at York, is the issue of data is across the board. It's a challenge, yeah? And I think one of the reasons that I am really encouraging Black leaders and Black organizations to pay attention to what's happening in the ecosystem within Black communities and the larger sector is the issue of data. So for example, there has been now for almost a year and a half, a very active provincial in Ontario, data coalition, which brings funders, nonprofit sector leaders and organizations and different types of social service organizations. There is no presence of Black community organizations in that coalition. And this coalition has been pushing for the government the government collects a lot of data from reports from the sector to give access to the data that governments has that so that we can use it for quality of program improvement, for funding, for policy advocacy. It has multiple uses. So one of the things I have been doing through NAPSI is to encourage this data coalition to open up its doors so that we can have more Black organizations sitting at the table.
Okay. So just want to make sure that everyone puts themselves on mute if they are not speaking. Now have a question from Marlene. So Marlene, go ahead.
Thanks. This is not about the coalitions, it's about the, I guess the benefits that has already been spoken of by Prime Minister Trudeau in terms of the mortgages that are deferred for 6 months. Do we know if this is automatic by the banks? Because most people's mortgage come out of their bank account automatically. So has the banks been given the go ahead and okay to adjust their system so that the automatic setup does not go into people's bank account and be trying to draw funds out that may not be there, which will put them into a lot of NSF charges. All of these things in the system is automatic. It's route. And the second question is about renters. So likewise, if those that pay mortgage get their mortgage deferred 6 months because they're not working or being diagnosed and so forth, it should be the same for those with the renters. So we need this to be addressed for renters as well. So that's 2 questions.
Anyone want to tackle that one? Nadine, go ahead.
Yes. Yes, so the first one in terms of access to funds through banks, actually that's a very good question because the conversation that we had this afternoon with Yvonne in particular was that what the government needs from us as Black leaders is in our communities to make sure that people have bank accounts, if they can have bank accounts, and that they fill out tax returns so that the money and monies that are going in to help people who are in trouble with rent and unable to pay their bills and so on, that people can get money directly. Money is going to be transferred to people through the tax, through CRA, and also into people's bank accounts. And they need to have bank cards in order to access those money, because a lot of merchants are no longer taking cash because cash is dirty and can spread the virus through the handling of money. So there's the programs that we anticipate coming down the pike from the federal government in terms of providing money to our communities requires our communities to be prepared and ready to receive those funds. So we have to be able to tell our people, and maybe this is a campaign or some information, that they need to get their taxes. So they're in this tax system, and they need to have bank accounts, and they need to be able to access their funds through online banking if possible. So that's going to be challenging for some of our people who are the disenfranchised, people who don't have homes, people who are mentally ill, people who can't get a bank account normally. So there's going to need to be some work that we do with the government to be able to find some of those people who fall through the cracks. Unfortunately, a lot of those people are from our communities. There's a reason why payday loan places are doing such good business. And a lot of our people access those payday loans and do not have the basics that many of us have in terms of being able to manage our sort of tax and our monies through financial institutions.
Yeah, Richard, I did want to add to that. I wanted to add to that we have some strong, what I say, partners and allies, because I got a call from CIBC yesterday or on Wednesday to say, how can we help? How can we help your members? We have strong relationships with other banks as well. And of course, a lot of the officers that are very friendly and reaching out are the Black managers. So I think, and again, I say, the BBPA is here to help with these relationships, because I think the best thing that's going to happen out of this pandemic is great relationships forged by these hardships. And so, our doors are open to make the introductions to the various friends that we have at the bank that can help through these processes.
I'm sorry, the response did not address my question. My question was, they have given those that are paying mortgages 6-month deferred payment. So they don't have to pay their mortgage for 6 months. Most people that pay their mortgage, or just about everyone, this is an automatic setup that comes out of their bank account. So the system is automatic. Are the banks going to stop the automatic withdrawals automatically because the citizens cannot do that? How is that going to be done? The second question was, what about those that pay rent? They are in the same situation of loss of income due to the lockdown, due to not being able to work or being diagnosed. So there was no mention of those that paying rent, that their landlords should also defer their rent for 6 months. So it's first is to the mortgage, whether the bank are going to cease and desist from going into the accounts of those that have a mortgage. And the second question is, does this 6-month deferring of mortgage also apply to renters? Because it should.
Yeah. So can I answer that? This is Andrea Pierce. Want to say there are no resources for renters right now. The only thing we've heard is some provinces, like Ontario said, that there's a moratorium on eviction for renters. So that's the only thing we've heard so far. And that's why we're having this conversation. So one of the goals of this conversation is to hear what the community's needs are and any roadblocks to accessing anything, or where there are gaps where you see that this is not being dealt with by this stimulus fund, so that we can bring it back and advocate on the community's behalf. So that's an excellent point. There's nothing for renters right now, the same as mortgages. So we need to bring that We don't know. The second thing is, we don't know as yet, and there's been no process if it will be automatically coming out of people's bank account or not. So I would say you need to call your bank maybe and stop that. So when we saw the stimulus package, there's not very many details on how these things will be implemented, except we just heard an hour ago with Minister Hussein and Minister Vaughn saying that it will be, the most important thing we need to do as a community is register with the CRA to make sure you have a CRA account and your bank account information, your social security, your name is in there so that the money can come directly to your bank account. Now, we don't know if that's just for the child benefit or or if that includes any mortgage payments or so. So we need to find that out, what the implementation of that is. I think the purpose of this call is we may not be able to answer a lot of your questions. What we want to know is what it is that you need that we can convey in our advocacy to Minister Hussein, Mr. Vaughn, to the Prime Minister's office, whoever, on our community's behalf, because we feel like we're left out and we cannot access some of these things.
Okay.
Thanks, Andrea. Quickly, with your permission, Dr. Vibe, I have sent a link on the chat around the 6 largest banks and the approach that they are taking. As far as mortgages is concerned, I had the opportunity to check about this early in the day to prepare for this call. Actually, it's on a case-by-case basis. You have to go and deal with your local bank around your mortgage. It's not automatic. I have just shared the link on the chat list.
Okay, thanks, Emmanuel. Next up, there's a question from Nene, and they're saying, hello, my question is for all the speakers. Most of our children are in public schools and rely on libraries to do their homework. What can we do to help these children in school that need to access things like access to computers and to do their homework? Who would like to answer that one or take a try at that one?
I kind of think that, you know, during this time where people are concerned about contracting the virus, that of course, getting people together is not going to work. I know that there are some groups, I know the homeschooling community here in Ottawa is expanding some of their supports to people who were in school and are forced to homeschool now. But there isn't anything coordinated. I've seen that the province of Ontario has also put out learning modules online for sort of online learning. This is, unfortunately, this is where they wanted to go with their online curriculum, which doesn't really serve our students all that well. But there isn't anything, other than that, there isn't anything concerted happening. But as I've been saying to some of the folks on the chat, we can take some, and what Andrea is saying, is that we can take some of these concerns and package them up and provide them to both federal and provincial governments to ask for or demand that they put these issues on the front burner in terms of responding to the COVID crisis. I see something from Donovan saying that a lot of what's been going out has been focused on the middle class. And there are many of our people who are not middle class and not getting any sort of access either to information or to the benefit, or will have challenges benefiting from some of the initiatives that are being pushed out. So that's partly why we're having this call, is to get a listing and to get all of this information so that we can package it up and provide it back to Minister Hussein and other levels of government to respond to the Black need across the country.
I think I just want to add that when we are talking about support for Black communities and especially the lower income communities, yes, that is where churches and faith-based communities come into play. Most of our people are low-income people, and usually they're looking up to the churches and their pastors for support in times like this. I know that we've had the restriction to numbers given up to 50 people congregating. And that generally means that for most of the Black churches, at least in Ottawa, most of them are less than 50 people, and it means they are still providing services to their communities. So I think Andrea's question is very valid. What support is being provided to churches and faith communities, that's including the mosques as well and other faith-based initiatives? What is in this initiative for these faith communities, which actually remain open, including my own church that remains open? I'll give an example. Our church, for example, runs a shelter for newcomers and refugees. We have no place to take these people. We have 30 refugees in our care, and the activities go on. Our operations are not stopped, and yet with what is going on right now, we are not having as much attendance in the churches, yet our programs to our people are open. All our youth programs are still open. We have to devise technology, for example, to be able to meet our youth and make sure their programming is still on. So I think that thinking about the Black community in particular, it's important for us to highlight the fact that especially the low-income members of our Black community rely on the faith-based communities, mosques, churches, etc. for a lot of support.
Okay, thank you, Reverend. And please remember that there is a certain order in which things are to be answered. And unfortunately, you jumped ahead of some people. So if you want to say something, please put your request into the chat.
Sorry, I didn't realize that. My greatest apologies. I'm really sorry.
No problem.
Yeah.
All right. So next up, we have Isaac. So Isaac, I'm just going to open up the... Okay, so Isaac Gimba, please ask some questions.
Okay. Let me see. Thank you very much, this entire team. I'd like to, first of all, thank Andrea Pierce for her hard work. It's an outcome of that I am on this call. She's doing an amazing work within our community. I am representing the International Pastors and Leaders Forum alongside with Reverend who just spoke. There are two dimensions. So there are some of our communities, churches that are less than 50. There are others that are more than 50. And those of them that are more than 50 who are not able to meet, generally speaking, besides providing spiritual guidance and support, we also offer comfort, counseling, care within our churches. And one thing I must say as well is that, generally speaking, the support we provide to our members who are also members of our community directly come from offerings that is collected every Sunday. And for some of these churches who are unable to meet, it has definitely affected how much that they're able to collect, and consequently, how much they're able to provide assistance within the community. Take for instance, there are some of our churches that provide food resource to those who are less privileged within our community. And I had just said, before now that our major source of income is from the collections we have from our congregations. And so when they are not able to meet, it impacts the chains of services that we provide to the members of our community. In the area of food resources that we reach out is depleted. In the areas of care and counseling that we provide, obviously some members of our community who have different health challenges, we provide some counseling, like spiritual counseling that is able to help them. Now, the individuals that provide this counseling, there are also people that we give them some, not a huge payment. Some of them are also kind of voluntary services, and some of them, we appreciate them and give them some financial support as well, just to sustain the work they do within the churches. The other aspect of it is technology. For those of these churches that are unable to congregate, they try to reach their members through the use of technology. Now, not all of our community members are, are quite good in accessing their technology, their computers, much less to talk to even emphasize that some of them don't even have computers. So we're talking about communication and reach to the very members of our community that we can assist. So when they are not able to hook on, it's a big challenge. I give you an example today. We had a meeting and we needed to beam out the meeting we were having using Zoom and other technology, and it was impossible because there wasn't an expert. So some of the things that based on the conversations we've had with some of our members of the pastors, is to perhaps have somebody who may be able to visit some of these homes and help set their, maybe their computer up in a way that they can be able to receive transmission, when we try to communicate with them in their homes. And then the last aspect I want to talk about here is when the churches are not able to congregate, it's difficult to be able to raise offerings that consequently help to sustain their rents. Many of these churches are renting. And so under these COVID restrictions, with less people coming in or not coming at all, it impacts on, so what happens to some of these churches? Would they shut down? Would they, in terms of rent, and they have utilities and things to pay? So these are some of the concerns that is very apparent with many of the pastors within the confines of our own community, and they are quite concerned about it. And it would be great to see what we can come up with in this forum. Thank you.
Okay, thank you very much. We are going crazy with questions, so I'm going to sort of limit the question length and the answer length. But I'd like to know if people, it's okay if we're going to do another one of these sessions next Saturday at the same time, because there is a whole lot of questions that are going on right now. So I'm just going to catch up, and we'll probably take about 3 to 4 more questions at the most, and then we're going to have to shut it down. So I'm just, actually, I know that there's a question from AJ. So I'm going to see if he is with us. So if AJ, if you're on the line, could you make your comment or question? Okay, not hearing from AJ. So next, I'm just going to get to, I just want to look here. All right.
Good evening. I just sent you, I am prepared to defer to give someone else an opportunity to speak.
No, go ahead. No, go ahead. Go ahead, please.
I think, thank you for the previous 2 pastors who spoke, and thank you for organizing this call. I believe we're at the point now where we can move from, responding to some specific actions, as we discussed in the previous calls early in the week, around clustering the issues and figuring out how we can move forward collectively on addressing these issues. What the pastors have articulated, though, is something that is of real concern, because we know two specific entities are at the backbone of the Black community: social service agencies and the church and the faith communities. And what I'm hearing now is that our conversations also need to shift to a strategy, because the reality is, while we're encouraged to practice social distancing, it's not really practical for some groups, because people are still reaching out. And when church doors are closed and people cannot find solace there, or when social service agencies don't have the resources to support people to fill out applications, to do all of those things, I'm just proposing that maybe on an offline or in a separate forum, that we really start to think about what that can look like, and who has resources right now that can support some of the lesser resourced entities, and figure that out in a separate in a separate forum, because I know that this is a real concern and this situation is going to continue. So I am offering through a dialogue that if anybody wants to reach out to CAFCAN, I know this is a national call, that I am offering for us to kind of have a conversation about this and figure out some strategies so that we can collectively support each other and take this matter into our own hands the best we could. Okay, thank you very much.
No problem. Thank you, Floydine. Let's see who we have up next. I'm just going to Jacqueline. Okay. So I'm going to try AJ again.
Okay. So I think there's lots of things being discussed and covered here. I think what we have to probably want to do is triage even the kind of responses so to better manage our expectations. So there's the emergency of COVID, and what are those measures and steps we want to capture, share, probably the short term and probably longer term sorts of solutions, some of which have been being discussed here tonight and in previous forums. So because when I think of this particular call, I'm more thinking about it from the point of view, what do we need to do today for those families, for those individuals, for those non-for-profits, for those businesses, etc. Because when we think in terms of how the machine works, it's on the kind of practical things you want to do. So for example, it seems to me, although there's been an announcement of the billions of dollars and the various what you can do, there's an additional step to disseminate information to people who are either too busy with real life to know all the details and intricacies and the process and the steps. So from a practical point of view, how do we get that information that probably 90% of the people on this call know down to a bite-sized granular level to those folks who need to know? There's some things like a 1-800 helpline or things like that that are really at a practical level. I think that's kind of where I'm seeing this. As far as the Black lens, I think, you know, we've talked about the Black lens as being absolutely critical, because as things move out into the broader community and they get more kind of unpacked in terms of what does that mean in terms of steps, process, how to apply, who to apply, you know, there's a lot of hand holding in that. And so the system needs to understand that within vulnerable and marginalized communities, you know, that has to be factored in. That's concretely what the Black lens is. So I just wanted to make that point in terms of at this phase where we should be talking about what can we do, what can the system do to kind of translate those things that looks like big dollar signs into real actionable items for the most vulnerable in our communities. And so that's what I'm hoping that beyond this call, we can kind of focus in the emergency day-to-day, seems to me the dissemination of information, what could non-profits do, what they need to cover operating costs right now. You know, are there some grants, are there some loans, are there some things that are there or should be there? So I think it's a capturing of maybe the next 30 days of what are the emergency needs of the various entities, business, not-for-profits, which includes in my mind faith groups, and the real vulnerable in our communities who can't really self-isolate, who can't really stock up for groceries for, you know, a month in advance. So I just want to leave my comments there. Thanks.
So we got two more comments. We're going to have Jacqueline and then Soraya. So Jacqueline, go ahead, please.
Hi, everyone. Can you hear me?
Yes, we can.
All right. My name is Jacqueline, and I am one of the co-founder of the Toronto Black Farmers Collective. We are urban farmers here in Toronto, and our work addresses the need of community and food security and food poverty. We farm in Downsview Park. We also farm in Milton. It's so sad that it takes something like this for our people to realize that we are at ground zero. We are at ground zero, folks. And so we need to have a strategy before we leave this call as to how we're going to continue to get information into the grassroots and the nitty-gritty of our communities. We have a lot of people that have many children, they're poor. We have elders that are living on very meager income. We have people with 3 and 4 jobs. We have people that can afford to buy food. And we have people that don't have money to buy food at all. They're not a part of the gold rush in the supermarket. So how do we, number one, create a strategy or find some way to stay communicated so we can continue to disseminate information and to have an anchor to take that back to the decision makers? That's number one. Number two, we are in Downsview Park. We're in the middle greenhouse. And if folks want to support the work we do, it's a not-for-profit organization and small grassroots organizers, that's where we are. We're at 70 Canuck Avenue, Keel and Shepherd side of Downsview Park. We've been reaching out to everybody, but everybody seems to want to shut our work down, hijack our work, and use it for their own selfish gain. We need to stop this, because we are nowhere in this great system that we're all trying to hold on to. We have each other.
Okay, thank you. Does anyone like Emmanuel, Andrea, Nadine, Richard have any follow-up on that comment before we get to Soraya?
Quick, Emmanuel here. I think the comments that AJ made are right on the mark. So how do we start at the tactics level, really making the, this practical for our communities? And I think along the lines that Adam Vaughan stressed, I think, what can we do today in terms of short term? I think I've shared earlier on, and I'll try to share it here again. One of the things I forgot to mention is since the call on Monday night, we have created a Google Drive where we have dumped close to 30 various resources that will support, business continuity, nonprofit organizations, business, and so on. And I think I encourage you people to, it's an open edit, creative subfolders of things that you think Black communities can use. And I have shared the link there, and please, you're welcome to continue building that with us so that can be used by various stakeholders in our communities. That's what I would say.
Anyone else?
Yes, this is Andrea. In speaking to Minister Vaughan today and Minister Hussein, they openly admit that the nonprofit sector, which includes the faith community, they have nothing, and they're looking to us to give them ideas and to tell them what needs to be done. So the follow-up, what I'd like to say to people is, this is a continued, everybody, we all have to, if we're gonna bake a cake and somebody has some butter, each of us has an ingredient that can add to make this cake, and this is why we're here. And the same way with helping each other and helping our community as a whole. So we need some action from everybody here today. They need to go on the UNDPAD push. They need to email CAFCAN as well, that's on the call. And we can then distribute and invite you into the further discussion and engage with you and have your voice heard as a part of the process. So AJ said earlier about the Black lens, what does that mean? The reason why the nonprofit sector is left out, not that white people don't have lots of nonprofit sectors, but the nonprofit sector is the backbone of the Black community, and our voices are not heard and is not considered on a regular basis. We're the outliers, right? So we're an exception to their system. And this is why we need to be banding together, having these conversations. So we're no longer, it's a form of anti-Black racism that we are the exception and our voice is not included. Now, whether this is unconscious bias or deliberate, but the behavior shows that our voice is not included. So I think people can go on the UNDPAD Push Coalition site as well, sign up, on the to get further information and to be a part of the conversation and to get plugged in so that you can be a part of the solution, not only for yourself but the rest of the community.
And Richard here, just to quickly add to that, I think it was Jacqueline saying, or someone was saying that there's many of our people don't have access to internet, don't have access to a nice, comfortable place to be able to do video conferences and conference calls. But if you are connected to us as UN Push, and we share information to you, you can share information through your various networks and then back through them back to us so that we can have those conversations with decision makers, as Andrea had said.
Okay, one last quick thing before we get to Soraya. Sophia Jacob, go ahead, please.
Thank you, Dr. Vibe, and thank you for everybody for putting on this call. Really quick, I want to thank, I think I see her name as Roxy B. Is it Roxanne?
Yes.
Yes.
Sorry, thank you, Roxanne, for coming on and helping to dispel some of the myths that we've been hearing with COVID-19, particularly around the Black community. A couple of different organizations had sent in those same concerns to our counselor here in Ottawa, and we are going to be having a myth-busting conversation with Ottawa Public Health on those same issues around that Black people can't get COVID-19 and la la la. So I'm going to let the community here know about that conversation because it's going to be a two-part conversation, as well as I see our mayor putting together a task force with the business community and the nonprofit community. So I think it can work having Black task force in our community here where we can support nonprofit and we can support business. And have different people on the task force, seeing what the needs are and coming back and then trying to get the information out and get resources out quickly. I think the mayor had a good idea with that because he can't do everything, so he's just putting help on his team. And then thirdly, over to Emmanuel or if it's Andrea that can answer the question, how do we help people get on and register? Is it just a quick registration with CRA? Just putting your name, your number. I was on with Minister Vaughn, and I have to really commend Minister Vaughn for his answering all the questions that a lot of people had. And I find that he was one of the ministers that has taken the time to actually really spend time with the Black community and be almost like our champion. He's one of the best people that has spoken since I've been in conversations this entire week. So I really appreciate his advice, particularly around filing income taxes. So I'm just wondering if we can assist people who are having problems there with these task force to kind of get them on to do that, either Andrea or Emmanuel.
Quickly, maybe Andrea can add. Sophia, what I'm going to do, it's already there in the Google Drive. There is actually a document from someone at Carleton University that actually developed a guide on how to apply, whether it's if you are on EI or if you are not on EI. She has really developed a great guide. I have put it on the drive, but I could also email it to Dr. Vibe and somehow he might make it available. So there is some very clear to use things that EJ was talking about earlier on around practicality. So I will share that, and that gives you a step by if you are on AI or not on AI, what are some of the steps that you can take, and it also gives you links to information. For example, the idea that Adam Vaughan was stressing around the bank account is direct deposit. So we need to be able to support people remotely to be able to complete some of these online forms that's going to come soon by phone. So I'll leave it there, but I will share the document with Dr. Vibe. But if you go on the link on the Google Drive, you'll also find it there.
Thank you, Emmanuel, for answering my question. And again, the Black Task Force with the nonprofit and the business community, I'm just wanting people to think about that, and maybe we can start that.
Okay, good thought out. So what I will do is now finally get Soraya on to at the end of our conversation. Just okay, let me unmute. Trying to unmute you, Soraya. There we go. Soraya is here, and she's going to give an update on something that some of you were supposed to be at this weekend. So Soraya, go ahead and introduce yourself.
Yes. Hi, everyone. This has been a lovely conversation so far and very informative. So thank you for all the experts and community workers that's been, providing much needed information here. My name is Soraya. For those of you I haven't met yet, I am Director of Communications and Programming at the Michael Jean Foundation, and as well as the lead coordinator on the third edition of the National Black Canadian Summit, which was supposed to take place this weekend in Halifax currently. I'm not sure, Sylvia, how everything is happening right now in Halifax, because I know there was so much excitement and momentum and a lot of people expecting it to happen. But the reason why I wanted to jump on this conversation is to let people know is that we are, it's not canceled, it's postponed. We don't have dates yet to provide. However, one of the things that we wanted to make sure of is that people feel included and that we are still able to gather some perspectives from across the country, no matter when and where it takes place. So one of the things that I've been talking internally with my team is to really look into potentially having those conversations online. So it's not to substitute the summit, it's not to replace the summit, but in the meantime, as we're just sitting there and just, rolling our thumbs, we should have those conversations, those very critical conversations. What I'll do is that I'll share with Dr. Vibe, who might already have it, the strategic action plan that was developed from the first summit. For those of you who haven't heard about the National Black Canadian Summit before, to give you an idea of what it is, it's really a platform to have conversations, meaningful conversation around 8 areas of focus that are critical to any group. That are indicators of development for any group. So we're talking about education, health, housing, justice, civic engagement, employment equity, art and media and journalism, and there's an 8th one that I always forget, but essentially migration, sorry, thank you. And so Emmanuel must be looking at me like, what are you talking about, girl? But no, so what we have done is that the work that we've done so far still stands, still available. But, in the meantime, we also want to make sure that the momentum that is created around building communities, not just around the National Black Canadian Summit, that there's a platform that we come to at least for a period of time to talk about those topics and really gather recommendations, but also compile some of the existing services that are in place for people of African descent in the wake of the coronavirus, the pandemic. We want to make sure that people that are always doing the work don't feel isolated. Like we were saying, like it's social distancing, but for a lot of people that's been doing this work, they need a platform where they can come and still build with community members from across the country. So we're looking into, I will be sharing some information later, but really looking into finding ways to bring those conversations online to include everyone. And so stay tuned, because we will announce the date very soon, because I think this goes back to some of the conversations that were brought here when a lot of you were just saying, how there needs to be a follow-up. How about we use this as an opportunity for follow-up? How about we use this as an opportunity to highlight some of the things that the government might not be doing that we can do on our end, or that we can call, ask the government to do better. So let's find a platform in the meantime while we're waiting, so that we don't just roll our thumb and just expect this to go away, that we keep doing the work, because I think after this pandemic, we're still going to go back to a regular scheduled program, and the systemic barriers will still exist. And so let's find ways to connect in the meantime. So I will share more details with you very soon. Within the next 2 weeks, I'll be prepping this. And so I will send you more information. So speakers will be invited. It will be just like the summit, but we're just bringing it online to everyone free of cost, because we do understand that a lot of people, one of the barriers that they have living in such a large country is being able to travel from point A to point B wherever we're hosting the summit. So that's another opportunity as well to include people wherever you are in Canada. So Thank you for this opportunity, Dr. Vibe.
Mercy. And if people want to find out more information about the summit, where can they go?
Yes, they can go currently on nationalblacksummit.ca. So that's www.nationalblacksummit.ca. We are updating the information as we go to share more information with people. We were sold out, actually, expecting over 1,000 people, which is a great thing. But you know what? The online component just gives us the opportunity to bring on more people. So they can find information there. They can also send us an email at communications@fmjf.ca, which is the general communication for the Michael Jean Foundation, if they want to find out more. I will make sure that through our superstars on this call that I'm pretty sure at least 90% of you know of, people like Richard, people like Dr. Vibe, and people like Emmanuel, Andrea, and Sylvia as well from the East, so that people know exactly what's going on, so we can all stay connected.
Okay, fantastic. Thank you so much.
Thank you.
All right, folks, we are going to call it at the end of another epic conversation. I'd like to say some shout outs to Richard, Emmanuel, Andrea, Sylvia, Floydine. If I'm forgetting anyone else on the core team, it's because of my head, not my heart. I'd like to thank every one of you. Oh, did I mention Sylvia? How could I forget Sylvia? That's right. All right. And I just want to say thanks. And if I've forgotten anybody, again, it's my head, not my heart. I'd like to say thank you also, Ralston King, for stopping in, Ottawa City Councillor and the City of Ottawa's first ever Black Canadian City Councillor. I have a strong feeling we're going to have another one of these sooner rather than later. So keep watch on your, whatever way you receive the information on this. This is the same way you'll get the information on the next one. I think Andrea is here. Go ahead, Andrea.
I just wanted to point out that information will be available on the UNDPAD push site and our various partners, CAFCAN as well. And in 2 weeks, we'll be having a session on dealing with anxiety during this crisis with a psychotherapist in the Black community, Leslie McEwen.
Yes. Yeah. Excellent.
That was on your site before, Dr. Vibe, so that, and it will be online, so all the community will be sharing that as well on the UNDPAD push site.
Fantastic. And also another upcoming conversation we're going to be pushing out there is the state of Black business in Canada, with one of the participants or one of the guests will be Nadine, who you heard today, and also Rustam Southwell from the Black Business Initiative. They will be the two guests leading that conversation. So keep abreast. And if there are any other topics you feel that you'd like discussed on this platform, please go to the website, UNDPAD website, and put in your requests. And if there's any questions that weren't answered at this time, again, go to the website, send it there, and they will respond to it. As always, I'd like to say, everyone, keep
quick last second shout out to Nadine Spencer.
Yes.
Brandy Q is providing us pro bono supports for that website that Andrea is directing people to. So this UN Push Coalition doesn't take any money from anybody. And so this is being done in volunteer and donated work. So thank you, Nadine, and thank you everybody for your participation.
Andrea, you want to add anything else, or you're good?
Thanks, everybody. Thank you all for your help and for participating. Let's keep working together.
All right. As always, everyone keep safe and keep in contact with each other, especially our elders during this time. Very important to keep in touch with elders. So yes. God bless, peace to all, and keep the faith. Good night, everybody.
Thank you. Good night, everybody.
Good night. Good night.